and thank you for joining this hot topic session on carers. I'd like to start by acknowledging that we're meeting on traditional country of the Kaurna people and pay our respects to elders past, present and emerging. It's my pleasure to introduce Stephen Wales, who'll be facilitating today's session. Stephen is the Community Engagement Consultant at Carers SA. He is a published author and community service professional of 30 years. Stephen's career has spanned across a wide range of client-facing and senior management positions and multiple sectors in South Australia, Queensland, the Northern Territory and Western Australia. And he has also lived experience as an unpaid carer, providing daily support for his wife, who lives with a disability. Over to you, Stephen.
Thanks so much, Jo, and it's a pleasure to be here and speaking with you today and talking most importantly about carers, because carers are often the forgotten part of our population. A lot of work goes on behind the scenes that carers undertake, and we're going to talk about that today, as well as how that crosses over into the volunteering space. So I appreciate everyone's time today, and I will just start by sharing my screen.
Fantastic.
Hopefully everybody can see the slide there. So that's our opening slide. So today, talking about palliative care volunteering, and the hot topic webinar today is focusing around carers. So, and again, my thanks to Palliative Care SA in particular for partnering with us as part of today's presentation. Just before we go too far, I'd like to acknowledge country, if my slides will work. There we are. So from the point of view, and just to back up what Jo was saying earlier, Carers SA also acknowledge the traditional custodians of the land on which we meet, work and live, and pay our respects to elders past and present. I'm coming to you today from Seaton, which is of course on Kaurna land, and we acknowledge the impact of history and understand and recognise the cultural strength, diversity and continual connection with the land, waters and community of the traditional custodians. So today's session, we're going to talk about who is a carer. And some of you who may be listening in today may in fact be carers. But what we find is that that is often a more complex question than what it sounds, because people don't always recognise themselves as carers. It's just something we do. Often we're a family member or a friend, who may even be a neighbour, providing care to someone, without really realising that we're taking on a caring role. It's just something we've decided to do, or we've found ourselves in a situation where we have to. And I'll talk a little bit about that as we go. How a carer's role may be impacted in terms of volunteering, the benefits of continuing to volunteer while you are a carer. We know that carers have to juggle a lot of responsibilities, but there are reasons why volunteering might be something that's beneficial to you as a carer. How volunteer managers can provide flexibility and support when someone is in a caring role, and how other volunteers also can provide support to someone who is a carer. So one of the things I'll just mention before we sort of get into the narrative here is these tiles you see. You'll see these throughout the presentation. They are actually real carers. And this gentleman here, he cares for his wife with chronic illness. So he's very generously allowed for his image to be used, and a little bit about his caring story. So it's very important to us at Carers SA that we're authentic with our messaging, and that we are, wherever possible, we're actually using real carers as opposed to actors. So that's so this is an actual carer here, and as Jo said in the introduction, I'm a carer myself. So I think that allows us to sort of see what life is really like for carers as well in the work we do. So, so this list you can see in front of you, this is a short list when it comes to caring, but hopefully gives you some indication of how broad the role can be. We know that caring goes on right across this country in a vast array of diverse roles, but what we know also is that we need to somehow capture that in a way that we can describe more easily. And when we look at this list, this is the way that we've kind of put that together in a more simplified form. When we think about disability, that's often a caring role that we see here at Carers SA. We see a lot of people navigating systems like the NDIS, which are very complex and challenging for often the carer is the one that is doing that navigating. Mental health is a big area. It's being spoken about more. I was actually at the QEH with an appointment with my wife yesterday, and they're building a new complex just across the road, which is I think 24 new mental health beds. So, and there's a lot more being spoken about, a lot more services being provided, but this issue persists as a really big one for our community. And what we see is a lot of carers in this space are really impacted significantly when they're caring for someone with a mental health condition, and often that's because it's episodic. So it does come and go depending on the condition, and that can be difficult for carers to understand what's actually going on and how they can support that person. We work closely with Skylight Mental Health as partners with us around understanding how to manage those conditions or support carers too. Dementia is a big one for us, working closely with Dementia Australia and understanding that dementia is now one of the most prevalent conditions, particularly for older Australians. But also we see a lot of people being diagnosed with early onset dementia. And again, it's a scary word. It's something that a lot of carers are having to grapple with, and we are here to support them when that comes into the picture. Long-term health conditions. So these are things that are not going to be around on a temporary basis. They're usually ongoing or long-term or permanent conditions. So that may involve things like MND, MS, all of the cancers that we know about, and even the rarer cancers we don't hear about, or other conditions that perhaps are harder to diagnose, but we know require care. Life-limiting illness. So again, we work very closely with Palliative Care SA around how we support people once they know that there is a condition of that nature in play. And we value the work that we do with them. Alcohol or drug dependence, again, one that people probably wouldn't think of first, but becomes very difficult for carers who are caring for someone who have those like those addictions. And someone who's frail due to age, which is really about supporting people who are getting older. We know we're living longer as a population. We also know we're living longer with chronic illness. So, and working with organisations like the Australian Frailty Network, and certainly our hospital systems, GPs as well, pharmacies and so on, so we can support carers who are in that space. And a lot of people identify with that through older parents or older grandparents. We know that for a lot of people that will come into play. So not an exhaustive list by any means, but a way to capture what we see in a lot of caring situations. So when we think about the caring role and what that involves, we often overlook the emotional impacts. So when I ask the question of people, what does caring look like? People will often think about the physical tasks or the things that they do that are tangible. What we don't realise is that caring has an impact over time, and it is a cumulative impact for a lot of people. The emotional giving out of support on a continual basis, if we're not giving back to ourselves as carers or we're not considering our own needs, that's where we see carers get into that space where they may be experiencing crisis, or they may have a burnout scenario, unfortunately. So emotional impacts are actually really, really important to acknowledge. Practical things, absolutely. Life does go on, but it's different. And I think caring can involve things as simple as grocery shopping. We often forget about young carers too. So carers between 5 and 25. So this is where we can provide support to people who are young and in caring roles. Often they've had to sacrifice a lot, not play sport with, or hang out with their friends, or be able to do things that they would prefer to be doing. So we do have specialist young carer services. Just getting people to medical appointments is something that if you're a carer, you're going to be doing in most cases, or supporting people to actually get there safely and return, get there on time, and also to be present for some of those conversations that maybe the person doesn't understand or needs support with. And that's where helping to communicate is so important as well, where you often as the carer have to advocate on someone's behalf, or interpret what's being said so that you can ensure the person understands or recognizes or realizes what it is that needs to happen next. It may be that someone hasn't ever been able to communicate, or maybe they've lost the ability to communicate or to understand. Personal care, again, if you find yourself, and carers often do find themselves in situations where things happen very suddenly, it can be a confronting thing to have to provide quite intimate care to somebody who would ordinarily be able to do that for themselves. And it's also difficult for the person receiving that care, so quite an adjustment. Preparing meals, so again, it might be different types of meals. It might be that the person has to be fed in a different way, or food has to be treated in a different way, because the person may have a choking risk now, or they may not be able to take in food orally, or there may be some other considerations. Often it's the carers who are at the front line. Administering medications. This is a really challenging area. It carries a lot of risk. I think for carers, they feel the weight of that sometimes, and medications don't always stay the same. They may change over time as a person's condition changes. There may be a whole combination of medications that have to be taken at different times in different doses. So that can be a real challenge for the carer as well. And then, of course, just the day-to-day tasks that still have to be completed. And I think once you've got to the end of the day, the last thing you feel the energy for, or the want to do is things as simple as cleaning, and that becomes a weight that also has to be carried. So, like carers say, that's something we can support with. So this statement, anyone, anytime can become a carer, is really fundamental to our work, because carers don't see it coming. It just it's something that happens quite suddenly, a diagnosis that people don't expect, or an accident that people are involved in that then means that care is going to be required. Or perhaps the birth of a child where something wasn't picked up in utero, and there's going to be a lifetime of caring as a result of that. So we acknowledge that, and we know that not all carers necessarily take on the role willingly. It's something that is difficult to adjust to, and takes some time. So as you can see there, it's not a rare thing. It's actually happening all around us. It's happening every day in our homes, in our hospital settings, in our society in general. Over 3 million people now, according to the 2024 Carer Wellbeing Survey data, which has just been released. So about 1 in 9 of us are actually in caring roles. These are people caring right now, and they know they're carers. So when we look at this number, we also know that there are a lot of people who don't recognise themselves as carers, and we therefore know this is an underestimate. So about 11% of the population, as we know it now, extraordinary when you think about it, because we're in the midst of an election, and yet these things really don't get any mention. We talk about the systems that these people have to navigate. We don't talk about who it is that's doing the caring and doing that work. Almost 400,000 young carers under the age of 25. That figure has jumped significantly since the last carer survey, perhaps because we're identifying more young people, working with schools and educating the educators to recognise carers, or maybe young carers are actually picking up more of that caring role as well. So really important we support young people in that space. Topical subject here when we think about the election and the budget recently, what it would actually cost to pay for all of the unpaid care that goes on each year from the family members, the friends, the neighbours. Almost $78 billion in value, the 2.2 billion hours of care every year. So that's something that we know the government can't afford. So we really need to look after carers so that they can keep people out of our hospital systems and keep that pressure off, where otherwise people would have to access that help. South Australia, so almost 250,000 unpaid carers. 30,000 of them are young people. So these are big numbers. Again, these are just the people that know their carers. When we look at the number of people who've accessed help through Carers SA and the Carer Gateway in the last 5 years since the contract began, we're reaching less than 10% of that number. So we've got a lot of work to do to continue to reach carers. We know that people don't always recognise themselves as carers, but we also know that even where they do, they often defer their needs to the person that they're caring for, and they'll say, I'm fine, don't worry about me, it's about this person. And we're saying, okay, we understand that, but we know that your needs are just as important as the person you care for. We're not saying you're more important, we're not saying you're less. It's actually important you see yourself as an equal partner in this. Often you have to be a team in order to provide that care. But if you fall over, what will happen to that person? So we really need to support both of you in how this works, and supporting the carer is really where Carers SA come in. So you can see another one of those tiles there. So looking at the volunteering space and how a carer's role might impact their volunteering, it's really important to acknowledge that there might be unexpected changes that occur in a carer's life. In order to volunteer, in order to work, in order to do other things, often there needs to be paid care in place. That's the case for me, so I can work. If that care doesn't arrive, or if there's a change to that care, it may mean that the person can't take on that volunteering shift. So it's important to know that and to be flexible around that. Caring is often quite impactful from a fatigue point of view. We know that carers often have to time limit their volunteering because they have to allow for other things that they've got to do in that day. There's only so much energy any of us have to do all of what we need to do in a day. So at Carers SA, when it comes to our volunteers, there might be a shift for a particular expo or an event or a presentation, but we know that there will be potentially a need for that shift to be shorter for volunteers. Juggling multiple responsibilities. Carers are often time poor and may have to adjust their volunteering based on other tasks, and that's something that we know we've got to take into account. So, but there are many benefits to continuing to volunteer if you are a carer, and I think we know that carers become isolated. but we also know that people need a sense of purpose. Often that when you become a carer, that sense of purpose sometimes becomes a bit lost if you're not working anymore, or you've had to reduce hours, you're not getting that social contact in the workplace. We know that volunteering allows people to feel productive and to do something that's meaningful for them. It's also a way people can develop new skills and allow people to develop in areas where they may not have had exposure before, or they get to learn something different, something new, which I've found that our volunteers have benefited from. And that social connection, the volunteers are a group in their own right, and they often see each other through different events that we hold. But they also have interactions with our staff, and they feel a sense of social connection, a sense of feeling valued for what they do. And they're also able to use that lived experience as a carer in the volunteering work that they perform. So looking at it from the point of view of a volunteer manager, it's really important, and we certainly, with this, the way we look at it here, to note that things do change, and they change often quite suddenly. There is a great degree of unpredictability about a carer's life. So things may not go ahead as planned, and that's something that just needs to be managed. And certainly when it comes to carers, that's something we understand here at Carers SA. Allow people to choose their own hours, allow people to not necessarily have to come to an entire shift if that doesn't work for them. It may be they need to start a bit later, or they need to finish a bit earlier, depending on what their situation allows for, and what their morning might look like, or what their routines are, and how they are able to make themselves available. And I think critically, this area of just being empathetic to people's situations and understanding that things are different for them, and they need to manage a lot of other things in the background, and being that listening ear that's willing to sort of lend some time to people needing to talk about what life is like for them, and how that's going to potentially impact on their ability to volunteer, or in this volunteer at the level perhaps that they would like to, but are not able to. How other volunteers can provide support. So being a buddy to a new volunteer. So we have a buddy system here. So if someone doesn't start a shift and is feeling a little bit at sea, they're actually able to feel like they've got support around them from others who have done it before, and understand our messaging and the way we describe the service, how we can assist in engaging with the public around what we do and supporting people that way. And also just that sense of feeling included and valued and recognised. It's really important, that whole idea that people have a similar lived experience is something that is powerful, because as carers, people feel very alone. They don't feel as though they're recognised by the wider society, and in many ways they're not. So I think being able to feel that you're part of something, I think it's an inclusive feeling, and it's something that people feel gives them a sense of that connection to who they are, as much as what they do and what they're able to contribute, as a volunteer. There is more information available. That's our website there at Carers SA on the screen, and I'd encourage you as well to go to the Carer Gateway for more information, as well, to bring yourself up to speed on what's available to carers. The Palliative Care Volunteering SA Hub link is there as well. I'd encourage you to have a look at that. And if you would be so kind as to click on the QR code and give us some feedback about this webinar, that would be really appreciated. Thanks so much for your time today and for having me come along. Really appreciate the opportunity. Thank you to the Palliative Care SA team.
Thank you so much, Stephen. That was absolutely wonderful. We so appreciate you giving up your time today and giving us some clarity around how a carer is defined and what their role is, and sharing the impact and benefits of being a carer was so great to hear. And it's really good to know that Carers SA, are there to offer support, advice, and guidance to people who are caring for a loved one. So thank you again. Thanks everyone for attending this webinar. This webinar is one of a series, and for our next sessions, we have secured expert speakers on different topics, which include culture and diversity, autism and inclusive volunteering, dementia, grieving and bereavement. And the last one is on spiritual faith and rituals. So we will be sending out some details of the events for all of you, and we'd certainly love to have you join us again. So thanks for attending and have a great rest of the day.
Thank you, everybody. Thanks
Thanks,
for
Steve.
having me.
Bye.